Calcium. Calcium is a very active molecule in the body. It's important for muscle cell contraction and it stabilizes cell membranes. If there's too much calcium in the plasma, a person can feel confused and can even suffer a cardiac arrest. Too much calcium is called hypercalcemia. If there's not enough calcium in the plasma, a person can have a seizure or heart failure. Too little calcium is called hypocalcemia. So we can see how it's important to regulate calcium, and there are 3 ways in which the body regulates it: storage, reabsorption, and absorption. So let's have a look at storage. The body can store calcium in large quantities. Can anyone guess where? In the bones. In the bones, calcium is mixed with phosphate to create bone mineral. Who would like to guess how much of the body's calcium is kept in the bones? 99%. Let's look at the reabsorption. Can anyone remember this from Kidney Week? Remember, the rate of reabsorption can be changed depending on how much the body wants to retain or excrete a certain molecule. Finally, absorption. Where can we absorb calcium from? The gastrointestinal tract. So, let's have a look at some of the hormones that are involved in regulating calcium. Can anyone name the hormone that is released when calcium levels are too high? Calcitonin. Calcitonin keeps the calcium in. If calcium is high, we don't want any more bone breakdown. That would make it more high. So, calcitonin inhibits bone breakdown. Calcitonin also decreases the reabsorption of calcium at the renal tubule. This allows the calcium in the filtrate to be expelled into the urine. All these alterations lead to decreased calcium plasma, and that has a negative feedback on any further release of calcitonin. Now, what about in the case of calcium levels being too low? Does anyone remember what hormone helps out in the case of low blood calcium levels? A clue is that it is produced by a gland that's next to the thyroid, the parathyroid hormone. Parathyroid hormone frees calcium from the bones. In the kidney, it maximizes the amount of reabsorption, and therefore it limits the amount of calcium that would otherwise be lost in the urine. In the kidney, it also calls on the help of a friend. Does anyone remember what it is? If parathyroid hormone is Batman, then vitamin D is Robin. Vitamin D is just waiting in the kidney for PTH to come along and ask for help. Vitamin D goes to the gastrointestinal tract and enhances intestinal absorption of calcium. Vitamin D also helps to maximize renal absorption. These 2 hormones together drive the levels of plasma calcium back up and inhibit any further release of PTH and vitamin D. And this is how the body regulates calcium.